Now, in terms of treatment, the most important thing is that because this is such a rare type of cancer, it's very, very important to be evaluated by a multidisciplinary team that sees a high volume of thyroid cancer, specifically medullary thyroid cancer. And this is very important in terms of having that evaluation and identifying the optimal treatment approach moving forward. Oftentimes, if disease is localized to the neck and to the thyroid, the treatment is often started by a thyroid surgeon, oftentimes involving surgery, as well as close follow-up and management for complications and some of these other things by a thyroid endocrinologist. On the other hand, some medullary thyroid cancers can also be more advanced and in some cases even develop metastases, which is a word that we use for spread of cancer to other parts of the body, such as the lung or the liver or the bone. And in these cases, in addition to surgery as a tool that we also have other tools such as targeted therapies. And targeted therapies are drugs or medications which can be used to target medullary thyroid cancer cells. It's very, very important with medullary thyroid cancer that not only genetic testing on the blood or the normal cells for a patient is performed, but also genetic testing of the tumor itself, because a large subset of medullary thyroid cancers have a particular mutation or change in the genetics of the tumor cell called a RET mutation, R-E-T. That's the name of the gene. And mutations that are present in RET drive many medullary thyroid tumors that are growing and progressing in the context of medullary thyroid cancer. The reason why that's very, very important for drug therapy options is that now we actually have FDA-approved targeted drug therapies that are able to specifically target RET mutations for medullary thyroid cancer patients with RET mutations. So the one of these, for example, is called selpercatinib. This is an oral, meaning a pill form of treatment, which is very, very effective at treating medullary thyroid cancer with a RET mutation. On the other hand, we also have other pill forms which work in both RET mutant and non-RET mutant medullary thyroid cancer, which are medications such as cabozantinib or vandetanib, which are drugs or medications that are also used or can also be used to treat medullary thyroid cancer with a RET mutation, as well as a drug called pralsetinib, which is also a RET mutant targeted pill for medullary thyroid cancer, again, largely for advanced disease or metastatic disease or recurrent disease that's come back in patients that have received prior treatment for medullary thyroid cancer. And so this has really changed the way that we've thought about the disease, having these tools in our pocket and being able to use these selectively in cases has really changed the way that we think about the treatment of medullary thyroid cancer. Additionally, with medullary thyroid cancer, even in the setting of metastatic disease, there are some cases where other types of local treatment can be considered, or even where a watch and wait approach can also be a reasonable or preferred approach, depending on your particular situation, which is why it's so important that the evaluation is performed by a multidisciplinary team with a lot of experience with treating medullary thyroid cancer.